requirement.
And while we know there are state and federal officials who support vaccines for young children, what about the doctors who treat them? News 12 Connecticut's Sean McCabe asked local pediatricians what the new shots could mean for your family.
We've already spoken with the state multiple times. We've already ordered our first doses of 100 doses.
Dr. Marcy Dillon says in this latest phase of the vaccine rollout, family-owned practices will have an easier time getting and storing supply.
By giving us a vial that's for 100 people and allowing now that vial to remain in the refrigerator for 10 weeks, we're sure that we will get through that entire vial.
The state's two largest healthcare providers working with the smallest clinics to make sure they have shots when they need them.
We'd be happy to coordinate that with them to make sure that they have the vaccine to give to their 2 or 3 patients, whereas we may have a larger volume.
Representatives of Hartford Healthcare say they've had time to master the art of immunization.
We've been doing this for a fair amount of time now in the vaccine space. We've vaccinated tens of thousands of people in the Bridgeport, Fairfield County area.
We had started planning pretty much at the point that we knew that Pfizer had applied, because we know that it takes a fair amount of time to figure this out.
Doctors with Yale New Haven Health say the emphasis on primary care providers makes a lot of sense for vaccinating kids.
They get their other vaccines at their pediatrician's office. They're probably going, hopefully, to get their flu vaccine right now as well.
Dr. Dillon says she's ready to answer parents' questions and concerns.
Sometimes it helps to know that as a pediatrician, I'm willing to give this to my children, and they'll be one of the first ones to get it in November.
Oh, that was Sean McCabe reporting. Hartford Healthcare and Yale New Haven Health say that they're both planning on reopening large-scale vaccination clinics once the shots are approved.